All right. Hello, everyone. My name is Kayla. I'm the office manager. We are Community Engagement and Consultation Group. As you know, you might not know, but welcome. This month is Mental Health Awareness Month. That being said, our topic for today is trauma-informed care across cultures. Before we get started, I would like to introduce our CEO and founder, Dr. Anita Mwalui, and
Thank
our
you. Thank
student
you.
and our student intern, Diana Ferdinand from Northeastern University. Welcome, welcome. Her first week with us. We're excited. Dr. Mwalui, if you want to go ahead and take the floor, go ahead.
Well, thank you. Thank you, Kayla. And welcome, Diana. Welcome. We do these pop-ups every Wednesday, depending on what the observation month is for that month. And May is Mental Health Awareness Month. We've been doing this for quite some time now, but and I always, take myself back and say, every day should be an awareness month for mental health, not necessarily May, but, being that this is a time that everybody does it, in spite of us doing it on a daily basis or a weekly basis, it would be great to talk about a few things that people normally don't talk about, and that's culture, the cultural considerations when it comes to trauma or mental health or everything, behavioral health. So with that said, let's just get into it. And by the way, before we get into the discussions, we were also able to crowdsource from our funds what kind of questions do they have, because we know that not everybody is available to attend these pop-ups. So we have some great questions that we're going to answer here. This is a discussion. This is a discussion. We're not diagnosing anybody. It's a discussion. So welcome again. So let's get into it now. What is trauma? What does it mean to you? And let me start with you, Diana. When you can unmute yourself. When you hear trauma, from your own what does that mean to you?
What trauma means to me is going through things that affect your emotional, psychological well-being, and it makes it hard to adjust to daily activities or your normal life.
Great. That's a good answer. A good answer. you know, and I've always, anytime I do these events, especially behavioral health, I always say that, I make sure to mention that mental health, trauma, they're all unique to us. The way we interpret them, the way we understand them, our lived experiences, our cultural backgrounds, where we live, it's all unique to us. Despite also having that definition, from SAMHSA or the CDC, it's or the World Health Organization, it's all unique to us. So to break it down, a traumatic event is one in which a person experiences, witnesses, or is confronted with actual or things that threaten their well-being. And that could be either an accident, it could be loss in a family, right? And when I say loss a loss of in a family, it could be that head of the household, I said, that dies, and now they're trying to figure out how they're going to move on without that. Who was the breadwinner? Who was the head of the family? It could be traumatic for a lot of people. It could be natural hazard. Hurricanes, or we have mudslides right now. There are a lot of mudslides going on around the world due to heavy rains. It could be a fire. It could be your childhood experiences being being a contributing factor to these traumatic events or trauma per se. So, like I said, it's unique to all of us how we decide to take it, understand it, and also that also will impact how we receive care. Okay. And like Diane said, it could also impact your physical well-being. It's very important because when you think about trauma, you want to think about, how it impacts you, your whole person well-being, your emotional, your physical. And I think that's where we also have to understand that, even when going to a provider to help us to build ourselves up, they have to understand, how we perceive, understand these events, how they've affected us. Okay. So then responses to a traumatic event, what does that really mean? That includes intense fear. Some people some of us who have gone through these traumatic events, we have that intense fear because we don't know what the unknown, we are, if not knowing the unknowns, it's definitely going to intensify the fear in us. We become helpless, and it's also horrific when you're going through such fear. Sometimes you don't even want to wake up. And I like to also to share that, every now and then, my girlfriends and I, we sit down and talk about some of these issues and try to see from a societal make how people cope up with these traumatic events. It's very difficult. And again, since this is there's a cultural piece in this, when we talk about culture, we find out that some of these traumatic events, are barely or hardly discussed within our families because there's a cultural piece that impacts how we open ourselves to vulnerability, because no one wants to be vulnerable. No one wants to expose their family struggles and challenges that they haven't been able to address. Okay. And then you also find that, with this trauma, there are also prolonged exposures to repetitive or severe events such as childhood abuses, which is likely to cause the most severe and lasting effects. And what are those childhood abuses? Because abuse comes from all kinds of, it comes in all forms. These are mental abuse, which can be also childhood abuse. There's physical abuse. There's emotional abuse. So abuse is not just a physical abuse. Somebody putting their hands on you. It could be mental. It could be emotional abuse. Poverty itself is emotional. Poverty itself is emotional. If you've grown up, for those who have experienced poverty, you know exactly, how you felt, when you are younger. And now that you're an adult, if you're taking you back then, how that makes you feel. Okay. So traumatization can also come from neglect, which is the absence of essential physical or emotional care. Again, it goes back to the emotional, physical. So how do we then restore that? How do we restore that? That's the question that we need to ask. And this is also where we bring in our providers. We were lucky enough to talk to 3 of our providers to seek their opinion, individually on how in their practice, how do they help their clients restore, their life after going through a traumatic event. It's hard. It's a 2-part, work in progress. It is the client and is a provider. But 80% is going to be the client and the 20% is going to be the provider. So it was very interesting to hear them talk about the different strategies, they have for client care when it comes to restoring, their livelihoods. But from a cultural piece, it is still something that, we have to discuss as a culture. With different cultures have different ways of dealing with situations. And I can tell you that in my own in my own circle of friends, having a common beliefs, yes, we're scared to be vulnerable. We have the fear of being vulnerable. But when it comes to trauma, traumatic events that we've all experienced, I think it's important to allow ourselves to be vulnerable at a certain extent, because we don't want that to be a generational trauma event, meaning passing it down to our own kids. And then if our children don't discuss that, then they pass it down to the next generation. That's something that we should try as much as possible to avoid. Okay. Diana, do you have some of those questions so we can go answer those questions as we go along?
Yes. So the first question is, how do providers train or practice trauma-informed care, focusing on inclusivity and emotional safety regarding trauma with people from different cultures?
That's a very good question, and that's a question that also I think, and this is going back to the conversations I had with the 3 providers that were able to interview. Inclusivity is going to be very key. Unfortunately, when it comes to things, behavioral health, inclusiveness is tied into providers' competences. How competent is a provider when it comes to a different or diverse clients that they are seeing? Because we have a system that focuses on a one size fits all. When it comes to whether whole health or behavioral health, one size fits all. We forget that our experiences are unique. That is something that we are working through. How inclusive do we want to be in providing care, in service deliveries? And I can also give an example of here in the state of Maryland, in the proximity of Washington, D.C., Virginia. I think we've done such a great job to create programs that are more representing, meaning that even the people who are running the programs look like the people that we serve. For those who are not aware, the DMV, the DC, Maryland, Virginia, is a mixing bowl of all kinds of ethnicities, over 100 languages spoken. So when a topic of inclusiveness comes into question, I think this is a perfect capital region to have that discussion. Now, I don't know how the other regions, around the United States, operate as far as programs are concerned. What I will tell you is, when we go to our friends in the Latino diaspora, I think they can concur on what I'm saying, that the representation is key to inclusiveness. So when it comes to resources, when it comes to programs, when it comes to, engagement, we have to understand that we have to be as inclusive as possible so that we are able to accommodate the different challenges that we see on a daily basis? That was a great question. Let's move on here. So then, when it comes to considerations providing culturally sensitive trauma-informed care, one of the things that come to mind, and this is something that we've always again discussed, you're going to hear this over and over because these topics are not new. These topics are old topics, recurring topics that we discuss every day. It comes down to viewing relationships through culturally sensitive, trauma-informed lens. What does that look like? The way we understand the role of a provider within a family world. Providers, who are those providers? Very important to know. And also to gain a better understanding of the roles and dynamics within a family. And that's where the first question comes in play. A lot of times when we're dealing with culturally different demographics, the dynamics within the family is going to be key. How is it discussed within the family? These issues that we face on a daily basis, how are they discussed within the family? And I remember back in the days when that was before the pandemic, when I used to facilitate the mental health first aid sessions. We often talked about family as a unit. How does family discuss some of the challenges we see every day? Does even family sit down at the table and ask questions such as, how was your day? Asking our kids, how was your day? How are your friends? Who are your friends? What are you doing this weekend? We don't have that time. So family dynamics is key to getting down and understanding on how to restore good living. Because like I said, 80% is the individual, the 20% is going to be the provider. Okay. And also, we have to consider and facilitate the inclusion of others, extended family. Now, there's the family dynamics, the immediate family. What about the extended family? Extended family could be also, the clergy, very important. From a cultural perspective, we tend to also rely on our faith, spirituality, marrying spiritual being and the scientific findings in healing and restoration. Okay. Very important. Now, if you want to discuss, the spiritual side of things, that's going to be a whole long, a whole different conversation. But, just to keep it simple, we have to also understand, the importance of our spiritual being and the scientific findings. How do we marry both to actually restore our livelihood, and healthy living? The other piece is the assessment piece, when it comes to things of cultural sensitivities and trauma-informed. Assessment is key, and I always like to use the assessments, the health and physical forms that we fill out when we go to visit our primary care physicians. I find it interesting that it's the same questions, do you have, for example, do you have diabetes? Do you have heart disease? Of course, they're trying to find out, what are some of the health challenges that you have or health issues that you have, in order for the physician to really get a good understanding, or the PCP to get a good understanding of, the client's health. But when it comes to, let's say trauma or behavioral health assessments, I think, personally, I think that should be individualized to really have a one-on-one, for example, when I go to my PCP, one of the things I like to talk about is how I'm sleeping. because sleep is also has been one of the symptoms that show up. Let me take that back. Lack of sleep has been one of the symptoms to not being able to hold ourselves together. In limited sleep, we know that we have to at least sleep 8 hours. But in today's world, how many people sleep 8 hours? How many people sleep 8 hours? So, I like to talk about, when I go to my primary care physician, I like to talk about, some of the challenges that I have, not being able to have a good 8 hour sleep. And we start from the discussions from there. And that's when he asks me, and I love him to death. I've been with the same primary care physician for over 20 years. Um, that's when he asked me, what's going on in your life? How are you eating? Are you exercising? How is family? When a provider asks you those questions, that's a very good provider. But unfortunately, it takes some time to build that kind of relationship with your provider. So to me, that's also another way of assessment. But we also have this, from a culture piece, we have this tendency of not being able to tell, to again expose ourselves, tell it as it is. And for those who have been in some of our health education series or sessions, I always encourage our learners or listeners or our audience that, sometimes it's always a good idea to tell it as it is. Tell your provider, what are some of those challenges you're going through if you're not sleeping, if loss of employment. Just tell them. He goes, that also helps to build, some kind of a care plan or plan of care. That's the word, plan of care. It helps to build plan of care, to start from there. So anyhow, Diane, what is the next question?
The next question is, how can providers create a space where people from various cultures can provide feedback to improve care?
How do providers? Interesting. Safe place. That comes down to also vulnerable. How vulnerable do we want to be? When we communicate, we want also to make sure that there's a level of trust embedded in who we are communicating this to. And this whole issue of being also, we don't want to have bias, to be biased against, have the biases, against. So a safe place is a place whereby provider listens non-judgmentally, A provider allows you to be you and allows you to ask the questions. That's a safe place. And not to go by the blue book of diagnosis. Because again, we are individuals, we are unique, we have different experiences, and we have different beliefs and perspectives on how we are affected. Okay. So trust, is has been shown to has been associated with to increase in patient disclosures in some cultural groups, trust. And again, this is where you see that if there is no trust, you'll see that more people will not even seek help if there's no trust. So trust is one of those things that is essential in a patient plan of care. It's very essential. Okay. And what's the next question? I know we're going through all the questions, but I do have some questions here as well.
Yes. So when people think of the word trauma, they think of people who suffer from abuse or people in the military, but often they forget about racism being traumatic. So how can trauma-informed care help with racial trauma or other unrepresented traumas?
Let me turn the tables a little bit around, with that question, what do you see within that question? Diana.
Yes. What do I see? I see oftentimes certain cultures experience different circumstances, and oftentimes they're often neglected or not given appropriate care when dealing with things that they have to deal with every day, such as racism or community violence.
Mm-hmm. Great, and right now we're in the era of diversity, equity, and inclusion, which I don't even know why we're still doing that, because there are certain things that will never change. There are certain things that will never change. Yeah, racism is a very hard one. It is a very hard one, and you know, from a person who has never experienced that, or a person who's born outside the United States, and then you will come here and you hear how racism has impacts one's health and well-being. You don't quite understand it until you go through it yourself. And of course, yes, there's a legacy of events that have actually contributed to why we're having this discussion. Discrimination, racism, all those are events that go years back, even within this 21st century, they're still going on. And that's why I guess during the pandemic, we talked about diversity, equity, and inclusion and how important that is, to address some of the challenges, mental health, trauma events that we have. Yet definitely, racism, discriminations are key contributors to traumatic events, and that comes in all kinds of forms. One of the biggest forms is employment. We see it all the time. When you're passed on an opportunity and you've been with an organization for a good number of years, you've contributed, and your key contributor to the success of that organization, when an opportunity comes whereby you need to be promoted and you don't, that can leave a lot of trauma. That can lead a lot of trauma to how you move forward. So, it's very unfortunate that we still have challenges when it comes to that. But anyhow, so then the other question that I have that was brought to attention was, how do we view treatment through culturally sensitive, trauma-informed lens? How do we view treatment? Treatment. Okay. Because when we talk about treatment, we are instantly thinking about, taking a white pill, a yellow pill, a blue pill, and being better. Treatment comes in all kinds of forms. These days we have, different types of therapies, which is still treatment. I am not I'm not a favor of taking medication. However, there's nothing wrong with doing that if it's going to improve your health and wellness. There's nothing wrong with that. I like the ideas of, group therapies. I like therapies. Let's talk through some of these things, because sometimes, we talk through these things, and we see where we can build our own resilience, because it's key, resilience. And a good friend of mine, every time we talk about resilience, like, Anita, I don't understand what that is. Are you trying to say that you just get up in the morning and say, today I am not going to think about what's going on in my life, I'm going to go on? Not necessarily that, because we have different ways on how to build our own resilience. Because I have a policy personally, I can only control with what I can only control what's within my reach. What I can control, I don't have to. I don't have to put more towards that. But if I can control a situation, I will control that. And that's why, to me, therapies are great. You have the ACT therapies, which is acceptance commitment therapy. Those are great therapy. The CBTs, the cognitive behavior therapies, those are great therapies. Building strategies. The individual, the client, having the accountability, owning it. Using the SMART goals to build that resilience and restoration. It's very important. Because definitely there are certain things that can change. We can change our families. Can we change our families? No, we can. We're born in the family, but to build resilience. So Diane, let me ask you, and apologies for putting you on a spot, but this is also one of the learning processes, when you hear the word resilience, or you can even give us an example. What are there situations or circumstances whereby you've had to sit back and think about how you are going to get up and go?
Well, resiliency is, in simple terms, getting back on the horse, overcoming whatever you've been through. I think there are many instances where I face hardship, where I've had setbacks, and what has helped me become resilient is my support system, my family, my friends, and therapy, helping me become more resilient, helping me realizing my strengths and what I'm capable of. I think that's something that's very vital, is not only your support system, but also therapy if needed.
It is, and I totally agree, support system. And, when it comes again back to our own, communities, especially, within cultural groups, support system is key. Remember I mentioned earlier, a family structure, a family makeup. How is a family made up? So that's your support system. But again, you still have, when it comes to this resilience, you still have the stigma associated with everything else, that comes with anything trauma, anything behavioral health, anything mental health. So support system is going to be key. And I always share that there's nothing wrong with having a therapy. If you have an insurance coverage, utilize it. Get a therapist. Having a therapist, which is actually also a support system, does not necessarily mean that, you're very sick and you need that, you should have that. It's just to have a support system, because again, we're humans. There are some days whereby you feel like, you can't handle things, or you're having a difficult time getting yourself together. That comes in. I have a therapist. I go to a therapist when I feel like, I can't handle things, or I'm overwhelmed, I'm exhausted. Exhausted meaning, in my thoughts. I can't hold it together anymore. I'm draining, so I go to my therapist. So support system. And now, for those who don't want to utilize a therapist, maybe if you have a good family structure, which is a support system, maybe that's the time to. And even with that, you have to have a format whereby you're not being judged. I remember in one of my sessions that I facilitated many years ago, this one incident where it was shared that, sometimes family judges, they call us names behind our backs. If you go to seek some kind of support, being called like lazy, you're lazy, why are you complaining? That was many years ago. Things have changed now. Well, yeah, things change, years pass. But if it's something that you've never been able to talk about, especially, childhood trauma, there's nothing wrong with addressing it and see how they can support, your family can support you through that. And that's one of the biggest challenges when it comes to, trauma informed across cultures, in going back and addressing some of the things that are impacting us later in life. They do impact us later in life if they're not being addressed. So, back to resilience. So resilience is the capability of individuals to cope successfully in the face of a significant change. Significant change, yes, significant change from childhood to adulthood to even older adulthood. Those are changes we go through. We go through changes. And if we don't talk about some of the things that have affected us, then, that's where we find that it's passed down. It's become generational trauma. Because after all, grandma, my mom, grandma were able to handle that. You should be able to handle that too. Generational trauma. We don't want that. Okay. The capacity changes over time and is enhanced by protective factors in the individual and environment, resilience, So getting yourself up and seeing what is within your reach, what is within your control to control that, it's going to be key, So again, when it comes to the trauma-informed care itself, we aim to avoid the re-victimization. We aim to do that, okay? Appreciate many problem behavior, which beginners understand about attempts to cope. So we need to really bring that to attention to the people that we serve. How do we instill coping mechanisms when an individual has been affected by the recurring events of trauma? Okay. How do we strive to maximize choices for the survival and control over the healing process? How do we do that? All these things, I'm mentioning now, a lot of providers bring them out. A lot of within therapies, they bring them out. And for a good therapist or a good person to listen is a person who gives you the opportunity to share what's within your reach and what you can do. And hopefully, have a good working relationship that is built on trust to build care, treatment plan. Again, treatment is not just taking medication. Treatment is, strategies, how you're going to use those strategies to pick yourself up and enjoy your life. Enjoy, restore the quality of life that, all of us deserve to have, We also need to understand each survivor in the context of life experience and cultural backgrounds. It's going to be key, within the lens of a provider. Providers have to understand, life experiences and cultural backgrounds in order for them to, in order for providers to be effective, more like sensitive care. They have to be that. Do we have any more questions?
Yes, two more.
Okay.
The second to last question is, what are the benefits of trauma-informed care compared to other methods?
And I think, with that, we've answered that, as we've gone through some of these, the points of the discussion. Read the question again.
What are the benefits of trauma-informed care compared to other methods? Like, why seek help instead of just keeping it to yourselves or just talking to like a family member?
The benefits of trauma informed is to avoid being a victim to yourself. Because a lot of times, I'll give you an example. If let's say I've had let's say if I've had abuse growing up, if I've had abuse, some kind of sort of abuse, right? And don't address that, talk about it. And I don't have to talk about it to family members. I could talk with my therapist. Then you know what? I become a victim of my own events. It recurs and recurs, and then eventually, we pass it down to our children. So the benefits of that, of trauma informed, is to really understand how to really understand how to build resilience and restore, better living. That's the benefit of trauma informed. And I don't know if that makes sense. So, and even the provider has to, the provider wouldn't understand the client until the client opens up themselves that this is what I'm dealing with, in order for them to help with whatever strategies they have within the trauma informed. But when it comes to culture, it becomes a little bit sticky, because the way culture impacts how we receive, access, and leverage some of the resources we have is totally different. And it's a big challenge right now. Okay. So let me look at some of these questions. All right. So when it comes to our environment, when with trauma-informed environment, the reliable support system could be a friend, it could be family members, and family members are repeated. It's going to be a repetition in how we heal. And not every family is there for you. Like I said, there's a lot of stigma when it comes to anything behavioral health, mental health, trauma. There's a lot of stigma to that. So within our healing process, we have to leverage a reliable support system, friends, and those the family members that would listen non-judgmentally, or friends who'll be there non-judgmentally. Access to safe and stable housing is also an environment, when it comes to trauma, wherever housing, wherever place that you are, is it safe for you? Does it bring back memories, those memories, bad memories, especially if there were issues of child abuse? Is there anything around that takes you back to that? Timely and appropriate care from first responders is key. And this takes me back to, the mental health first aid trainings that I used to facilitate. Is when usually when you see, let's say, a neighbor or a family member acting up, in a non-normal way. I should say that non-normal way. I don't know if that word exists, but non-normal way. Maybe throwing things. It's easier to call 911 when you feel that your life is at gender. But one of the things that we've always stressed is when you call the first responders, make sure that you tell the story. For example, you would say, hey, I'm calling for Jane, making up the names. I'm calling for Jane. I'm calling for Jane. Jane is my aunt, or Jane is my whatever friend, cousin, daughter. Jane is throwing things around, but Jane also has a history of mental health. Make sure you mention that, because we've seen situations going sideways, right? Jane has a history of mental health, abuse and and so on. And so when they show up, they know that this is a behavioral health situation that we're dealing with. Otherwise, if we don't say that, we just say, there's a deranged person in front of me who's acting funny and with a knife and throwing stones, they'll come and something bad might happen, and then we end up losing that person. So it's very important to inform the first responders exactly what's going on and give a little bit of a history of what's going on. It really helps a lot, you know. So some of the behaviors or some of the strategies, we often share with our clients are, good self-care, such as sleeping at least 8 hours, 8 hours, 8 hours, 8 hours, 8 hours. And I don't know how many people sleep 8 hours. I don't sleep 8 hours, but it helps. 8 hours. And the other thing that I like to share is self-reflection. Self-reflection is going to be key. Like I said, things that are within our reach are going to be are key. Whatever we can control, let's control that. If it's not something we can control, there are some family members we can control no matter what. There's some bosses at work we can control no matter what. If you can control, leave it alone. Let it not stress you. Move on. Okay, after all, life is too short, right? Eating well. Because sometimes, when we are stressed over some traumatic events, we tend to, get in things that we shouldn't get into, like eating poorly or, abusing alcohol because, it's a coping mechanism, but that's just for a short time. So we don't want to think about it. We don't want to think about those things. So you take a little bit of drink, and by the time you realize, the next day you're doubling that, the following day 3, you're tripling that. No. So we just have to pay attention to those. Again, it all comes down to what we can control and what we can control. And allow me to share. Lately, I've been actually not lately. Beginning of the year, January, I decided that I would be exercising mindfulness. So if you don't know the concept of what the concept behind mindfulness, Google. Google should be your best resource. Google. So mindfulness is, taking myself into reflection. What is important to me? What can I control? What can't I control? For example, if let's say I apply for a job, right? And I get rejection. Apply for another job, I get rejection. What do I do? Should I stay, stop mopping over that? Or should I just move on? So if I get this X number of rejections for that job, I'm going to move on. Then I'll know that that's not for me. So in my mind, I'm protecting myself, mindfulness. It also comes to events that have happened to us. How do we protect ourselves from being victims of things that have happened to us in the past? You have to really think about really, really, really hard. Okay. Exercise. Gotta exercise. We gotta exercise. We have to exercise. And exercising does not necessarily mean, you are going to join a gym. We know, that you and I have done that. Okay, join a gym. No. Exercise could mean, hiking. I love to hike. Hike or walk or get on the bike. Do whatever I can outdoors. Outdoors are very good for us. So those are behaviors we can actually equip ourselves with. Practicing good boundaries. Boundaries. Practicing good boundaries. Boundaries could go into so many different directions. Those friends that really remind you of unsafe environments that once upon a time the events happened. So practicing good boundaries. I'm not going to let that happen to me. Learning to say no. That's a boundary. Learning to say no, that's a boundary. Using positive coping mechanism versus negative coping mechanism, that's going to be key. Again, that goes into, drinking, because we want to numb some of the events that have happened to us. So the good coping mechanisms versus bad negative coping mechanisms, and you'll find that a lot of these strategies, we have them. It's just that, they just need reinforcement. How do we reinforce that? Is understanding that, what, I have all the ability of restoration and I have the resilience. Okay. What is the last? I know you had a last question.
Yes, this is the last question. How can people from various cultures encourage others to seek services such as trauma-informed care?
Accessing services, it's trust. If, let's say, let me use an example of some of the classes, the sessions that we've had. The way we encourage folks to access the resources, such as trauma-informed, is first of all, you can't force anybody to access resources. We can only share. As a nonprofit, we share a lot of resources. We can access them. But to encourage folks to access them is you have to build trust. They have to have trusted you. They have to have trusted you, that yes, it works. And also the other, to be mindful, what works for me may not necessarily work for another person. So we have different ways of, of how we accept some of these resources. I'm more of a talker, as you can hear. For those who know me, I'm more of a talker. I love to use my own words to get myself up and go. Whereas there's some people who rather have somebody else be the reinforcer. But, individual reinforcement that is within us, it's a trait that some of us have. Some people have a trait that, I'm going to reinforce this on my own. Whereas there's some folks or there are some individuals who rather have somebody else reinforce that for them. That, hey, you're good, you're beautiful, you can do this, versus, I know I can do it. So those are two different things, right? So to access resources is an individual thing. We can force people to do that. And this is a country whereby they always say the customer is always right? I hate that slogan. Customer is always right, So the client is always, can reinforce that. We can't force them to do whatever they don't want to do. Or even if you know that this is the right thing for them, this is a good thing for them, we can't force that. So more like they're always right. They know what is good for them. Okay. Now, let me also just, talk about, and I know we have a few more minutes, but a sense of meaningfulness is going to be key, when it comes to trauma-informed, again, to seek help or to seek that care, especially culturally competent care, is to also have the sense of meaningfulness. What does it mean to you? How meaningful do you want to be to yourself? Because life is too short again. So it's going to be key to get yourself to a place of where you feel good, the slogan, I'm sure you've seen the slogan, life is good. You've seen different t-shirts, life is good. So you get yourself to a place whereby, life is good for you. Life is good. I feel good today. And it's tough. It's tough, especially, these days, where a lot of people have never recovered from COVID. Aftermath, losing jobs, loved ones, So, but getting yourself to a place of feeling good is something that, you know, we all can do if we have all the resources that are available to do that. Yeah, but anyway, so do you have any final words on this, Miss Diana? On this discussion?
Well, well, no, I think you covered exactly what it means to not only break genital trauma, but also the benefits of trauma-informed care and how it can help not only different cultures, but also empower communities and bettering themselves.
Mhm. Good, you know, and you know, I don't like, and that's why, you know, for those who have attended, you know, our sessions, you know, live stream, because we love to live stream to share some of these resources for so many people, is I don't like to be scripted. I like to have a conversation, you know, because these are the things we say. We live with these things every day. We know these things, but then how do we bring them out and share, or how do we build, like, how do we build our own resilience? We want to learn from other people. You know, how are they building? How are they building their own resilience? What can I learn from them? So it's very important. But anyway, again, we are a community engagement and consultation group. We have a lot of resources that are available. We work with many various community-based organizations, you know, that offer different resources that we don't have. You know, resources meaning, you know, services. You know, resources mean services. You know, so if you're interested in knowing more a little bit of what we do, please go onto our website. There are so many ways you can fill out or become up to date with what we're doing. And that website is www.ce-cg.org. Again, that's www.ce- like a dash, you know, cg.org. You know, we have a lot of resources available. We have a lot of services available. And whatever we can do, we can always refer to our coalitions. All right. All right. So this was great. So stay tuned. Miss Hughes, do we have a pop-up for next Wednesday? Do we have something planned for next Wednesday? Is that the
Yes,
Wednesday or
we
Thursday?
do.
Okay, so why don't we tell our viewers what's coming next week? What's the title of the next week's pop-up?
Yeah, sure. So our next pop-in will be community support and resources for mental well-being.
Oh, okay. That's another one. That's a big one. That's another one. Again, you know, that will be something that I will probably have, you know, someone else from our coalition come and share some of their resources that we have. But stay tuned again. This is Dr. Mwalui, and thank you, Diana. Diana, our intern from Northeastern University, doing her master's in public health. So we're excited. So stay tuned. And if you want more of our recordings, these are also hosted on our YouTube channel. So what is the address to our YouTube channel, Ms. Hughes?
I'm not sure on the top of my head, but if you search in community engagement and consultation group, will pop up.
Oh, great. Wonderful. Good answer. All right. So thank you. Have a good Thursday. It's a nice and beautiful outside. Go out, take a walk. Remember, self-care is key. Okay, reflection. All right. Thank you, ladies. Great.